Something big just happened in the world of health and performance science. And if you're a bodybuilder, a biohacker, a longevity enthusiast, or anyone who cares about cutting-edge recovery and optimization, you are going to want to hear this. 14 bioactive peptides, compounds that were effectively banned from legal access by the FDA back in 2023, may be on their way back. Through licensed, regulated compounding pharmacies, legally, safely, with a prescription. I'm talking about compounds like BPC 157, ipamorelin, epithalon, C-Max, TB 500, and more. Stay with me, because this is a story about science, regulation, safety, and what it actually means for you. Let's start with the basics. What exactly is a peptide? Think of a peptide as a short-chain amino acid sequence, a tiny biological messenger that your body already uses to regulate almost everything. Healing, metabolism, immune function, hormones, cognition, sleep, and cellular repair. Insulin, a peptide. Many of your growth signals? Peptides. These aren't exotic alien molecules. They're compounds modeled on the body's own biochemistry. What makes bioactive peptides so interesting to researchers, clinicians, and performance communities is their specificity. Unlike broad-spectrum drugs, individual peptides can be targeted to very precise biological functions: tissue repair, fat metabolism, immune modulation, cognitive enhancement, and more. So if these compounds are based on natural biology and have been used in clinical and performance settings for years, why were they banned in the first place? In September 2023, the FDA moved 19 peptides into what's called Category 2 on its bulk drug substances list. That's the restricted list. The reasoning? Concerns about limited large-scale clinical trial data, manufacturing purity standards, and what regulators called potential safety risks. Compounding pharmacies, the licensed, regulated facilities that prepare customized medications for individual patients, could no longer legally make these compounds. But here's the problem. The demand didn't go away, it went underground. A gray market exploded. Offshore suppliers, research chemical loopholes, unverified online vendors selling peptides with zero quality oversight. No sterility testing, no accurate dosing, no pharmacist review, just vials and hope. For people who inject these compounds subcutaneously, the risks of an unregulated supply chain are very real. Contamination, mislabeling, incorrect concentration. These aren't hypothetical concerns. They are documented problems in the gray market. Now here's where it gets interesting. On February 27, 2026, HHS Secretary Robert F. Kennedy Jr. appeared on the Joe Rogan Experience, episode 2461, and made a significant announcement. He stated that the FDA's original Category 2 classifications were made without the required safety signal to legally justify them, and that approximately 14 of those 19 restricted peptides would be moved back to Category 1 status, making them eligible for compounding again within a matter of weeks. Kennedy also made the gray market argument directly. By pushing these compounds off the legal market, the FDA didn't reduce demand. It created a black market. Now, important caveat here, no official FDA rule has been published yet. The Federal Register has not been updated. These restrictions are still technically in effect until that happens. But the regulatory signal from the top of HHS is significant. So which peptides are we talking about? Based on expert regulatory analysis, here are the compounds most analysts expect to be reclassified. BPC 157, thymosin alpha-1, TB 500, and AOD 9604. MOTS-C, GHKQ, epithalon, C-Max, and Selank. Also expected, KPV, Kispeptin-10, DSIP, and growth hormone releasers, ipamorelin, and CJC 1295. That's a list that covers recovery, longevity, hormonal health, cognition, metabolism, and immune function. There is likely something on that list relevant to you. I want to speak directly to those sourcing through the gray market. The gray market is genuinely risky territory. A licensed compounding pharmacy operates under state board oversight and FDA inspection. They follow USP sterile compounding standards. There is a licensed pharmacist and a physician involved. That is a fundamentally different safety profile. If this reclassification goes through, you will have the option to obtain these compounds the right way, with quality assurance, proper dosing, and medical oversight. Cutting corners on safety works directly against your health span goals. As of right now, the restrictions are still in effect, but the move to restore these compounds to legal compounding eligibility is clearly in motion. This is good news for safe access to emerging health technologies. If you want the full deep dive, including a breakdown of all 14 expected compounds, We've put together a comprehensive article at Unbedside Manners. Head to unbedistamanners.com. The link is in the description. Hit that like button, subscribe for more performance science, and share this with your training group. I'm David. This is Unbedside Manners. We'll see you in the next one.